I am Dr. Briana Shearer, and I am a adult geriatric nurse practitioner, and I teach in the MSN program at Missouri Baptist University, and I serve as our simulation coordinator for our graduate program. So I lead the charge in integrating simulation across our curriculum and all of our NP tracks, as well as our nurse educator and our nurse leadership tracks. Our program at Missouri Baptist University is completely online, asynchronous, and so simulation really helps us as faculty be able to bridge the gap and see truly how they're applying what they're learning in their didactic courses in these simulated cases. What we're looking for with simulation is a program that allows them that immersive experience with a patient just as they would get in the practicum setting. So getting that history, doing that physical exam, identify those differentials, and work through their evaluation and management plan. So what we love about Sketchy is that Sketchy leverages AI in a way that makes the learning engaging for students because they're getting that adaptive feedback in the moment as they're working through the case. And what we've seen as faculty is that it almost combats AI use by using AI. Each step is set up very sequentially in a way that really forces the students to engage with the material and re-evaluate their differential diagnoses throughout the whole process. Many of our students choose to work through the case a second time to really solidify that learning, and that speaks volumes to how much they enjoy working through those cases and having DDX implemented into their curriculum. DDX does a great job of revealing different knowledge gaps and areas of growth for students because we are able to see their thinking pattern and their thought process as they're working through the cases, and they're able to look back and see that as well. So they're able to tap into the metacognition aspect of learning and be able to really solidify what their takeaways are from that case. We're able to get a glimpse of where those students are at and then be able to target areas where we can help them grow and where they kind of are meeting those benchmarks and where they might need a little bit more support. As a faculty at the end of a case, I can pull up all of the data and I can see what the most commonly missed areas are. So for example, I can see if my students all overwhelmingly struggled with the history portion of that case, or if they struggled with the physical exam portion of that case. And so that gives me really great data to know, oh, this is a spot that now I need to tailor some additional education to help fill those gaps for these students. DDX has made it much easier on me as a simulation coordinator and delivering active learning strategies to our students because the cases are already built and they're already built by experts in the field. There are hundreds of cases to choose from, and you can easily navigate and filter through based on the setting of the case, the type of the case, the body system that you're looking for. And so that makes it really easy to be able to pick which cases align with the course content for that week. We're also able to customize those cases to the level of the learner. So if I have a student who is in the first semester of their program and I don't quite want them to have to work through the differential diagnoses yet, we can have the DDX team truncate those cases so that they're only working through the portions of that case that I want them to as the educator. And then they can return back to that same case later in their program and work through that full case and the differentials and the management. And so it almost makes it an unfolding case as they move throughout the program. And I've also been able to use the creation tool and develop cases myself that I've submitted to Sketchy and have been able to be added to our institutional library that are maybe areas that a case did not already exist, but that I really wanted my students to be able to work through. As a faculty, the support that I've received from DDX and the entire team, from our sales representative to the implementation support team and the tech support team, has made the implementation in those initial phases really a fantastic and seamless experience. I would highly recommend NP programs consider implementing DDX into their program, whether they're asynchronous or synchronous. It's been a phenomenal experience for us as faculty, but also for our students. And we're able to see really the growth in their clinical reasoning and their clinical judgment as they have been working through these cases.